Hi everyone, my name is Leah, I'm a medical doctor. I decided to make a series of medical reaction videos for educational purposes about some of the common diseases for both medical and non-medical people, which means I will speak in a plain English language rather than the medical jargon. These videos will also cover many of the topics for medical students, so it also contains information and comments that can be used in day-to-day life. So let's start from scratch. So as you see, this is an image showing an abnormally shaped hand. If you compare this hand to your hand, you'll notice that this image contains like nodules at the small joints of the hand. The patients tend to have swelling, severe pain, and also stiffness early in the morning that tend to wane off during the day. So this condition is called rheumatoid arthritis, which is severe inflammation of the joints and destruction of the joints, destruction of the joint capsule, the cartilage of the joints. So some of its causes include having like family history of this medical illness. Also smoking increases the risk of having this condition. Being a woman also increases the risk of having rheumatoid arthritis. It's much more common in females than males. Once these signs are seen in a patient, you should refer him to a rheumatologist, because this is a serious condition that should be treated with strong medications such as steroids and medications that are much stronger than steroids. So it should not be ignored at all. Let's see next case. This image also is showing different eye colors. One of the eyes, which is the right eye, looks normal, and the left eye, which is on the right side of the image, looks cloudy and bluish white in color. This condition is called cataract, which basically means clouding of the lens of the eye. It leads to a decrease in vision, and sometimes if the cataract is severe, it causes complete vision loss in that eye. It tends to occur in elderly people who tend to lose vision, especially in low light settings such as driving at night, those who have trauma to their eyes, and those patients who have skin conditions requiring treatment with the steroids. So the steroids are predisposing factors for cataracts. So once you see this in your parents, any elderly person, any cousin who is suffering from declining vision, especially at night in low light settings, you should encourage them to go to see a doctor, because this condition is reversible most of the times. The cloudiness can be replaced by an artificial one, and to restore the vision completely after the surgery. So it's a treatable condition. It has many causes. Some of the causes are congenital, but most of the cases they are occurring in elderly people, or those with trauma, or those who take medications for skin conditions. Next case, it's a video. So you see, this is a man trying to drink water, or something like a tea or water. It's a fluid, but he's afraid to be close to this water. Being afraid of drinking water or being close to water is called hydrophobia, and it's a pathognomonic, almost pathognomonic sign for a dog bite rabies virus. So this virus causes inflammation of the brain of the humans and mammals, and is extremely fatal, because unfortunately till now there are no treatments for this viral condition. So most of the patients die from this disease because, as I told you, unfortunately there are no medications for this condition, and this is why it's important to keep stray dogs away from the streets. There should be organizations taking these dogs away from the streets, because it's a serious and fatal condition. There's also a vaccine that's available for rabies that should be taken by everyone in the community. Let's see this case. So as you see, this is a tummy or belly of a person. You can notice his navel or belly button are abnormal. They are larger than normal. There's a swelling at the top of the navel. This is called umbilical hernia, and it's mostly caused by lifting heavy weights, by practicing heavy exercise without heating up at the start. So some say that it can be run in families who have same condition, maybe a genetic cause that predisposes people to have this weakness around the navel. It can sometimes squeeze the bowel and causes bowel obstruction, which is a very serious condition that should be treated by surgery, by opening the tummy and doing the surgery to release the bowel. So it should be taken seriously, and during the surgery they insert a mesh inside the abdominal wall to protect from future hernias. So as you see, this is a sleeping child. He could look like a normal child, but he looks very yellowish, like a lemon color. This is called neonatal jaundice, which is yellowish discoloration of the skin and mucous membranes, I mean the mouth, the eyes. Also, the eyeball can turn into a yellowish color. This yellowish discoloration is due to a byproduct called bilirubin, which is a byproduct from an endoproduct from hemoglobin. Newborns who have this condition must be treated immediately. Once you see this condition, you should bring your child to the hospital. If the bilirubin level is above a certain level, and if it's high enough, it can cross the blood-brain barrier and causes permanent damage to the brain of the child, and the child has to live with the consequences of this damage his whole life. So it should be treated with blood transfusion before this damage occurs. And the neonates, after birth, they should be kept for monitoring in case they develop yellowish discoloration of their skin. So if you notice yellowish discoloration in a neonate, you should bring him or her to the hospital for treatment, or at least monitoring of the level of bilirubin, because this is dangerous. You should ring the bell and come straight forward to the hospital. Next image. You can see here a woman in a plane holding and breathing in a bag because she has sudden anxiety attack. This is called a panic disorder, and it happens when you feel you are overwhelmed and you are about to die or suffocate, or you cannot cope with your sudden rush of feelings anymore, without any reason and sometimes with reason. So sometimes patients have heart racing, sometimes they feel they are out of breath. Other symptoms are also possible in this disorder. An example of this is what happened to Tony in the Sopranos TV series, when he got the anxiety attack or the panic attacks, and he loses consciousness. He has loss of consciousness and shortness of breath. And because of that, he went to see a shrink or a psychiatrist for therapy. So if you know anyone with these symptoms, advise them to go to the doctors, to the psychiatrists, because there are many options for treatment, including psychotherapy, which are, let's say, training sessions at the clinic, sometimes medications if the psychotherapy is not effective, and sometimes combined therapies. So let's go to the next case. This is an image from a microscope showing the red blood cells that carry oxygen to the tissues. As you see, they are the red circles here that dominate the picture, and also showing something else that is abnormal. This is actually a parasite called Trypanosoma brucei that causes a disease known as African Tribanosomiasis. You can assume from the name it's mainly in Africa, and also called sleeping sickness. It can cause many symptoms such as fever, swelling glands in your body, such as in the neck, in the armpits, or in the groin. And also when it invades the central nervous system, it can invade the brain and causes disturbance in your sleep pattern. For example, you sleep at the daytime and tend to wake up at night time. And sometimes where the disease is advanced, you can sleep 24/7, and that's unfortunately a fatal case most of the times. The most dangerous thing about this is that it can be transmitted by a type of flies called tsetse flies. Most of the medical students know this type of flies, or biology students. That is why it's important to keep the streets clean all the way to prevent the spread of this type of flies. So that's why flies are dangerous and should be eradicated from rich and poor countries to prevent this disease, because it's a serious one. I'm sure everybody knows the diagnosis here. Acne is very common in teenagers and adolescents. It can be treated by antibiotics and other medications, such called ritans or vitamin A derivatives. Some of the studies say that females who take combined oral contraceptive pills or COCPs have an improved skin condition and improved symptoms of acne in females. Let's go to the next case. This is an extremely common skin condition. This is a hand with some fleshy bumps on the fingers without any pain or bleeding. These are called warts or Viroquas, and they are caused by human papillomaviruses or HPVs. They can be transmitted through sexual contact, sometimes transmitted through hand-to-hand contact. Also, through some of the studies say they can be transmitted through clothes. So it can also unfortunately appear in the face and could be greatly disfiguring to the face, because it can because the ones that develop in the face have different features. They can have like more tanned appearance that's devastating to the skin actually, especially females. It appears months after getting the virus. It doesn't appear from the first week or the first month from shaking a hand with someone or having sexual contact with another infected person. So the treatments for this condition actually include short-term and long-term treatments. Short-term treatments include mechanical removal such as cautery or freezing, or even applying chemicals to burn these fleshy bumps. And long-term treatments include those medications that enhance the immunity, such as vitamin D or zinc especially. Most of the dermatologists use zinc sulfate or zinc gluconate in the long term to treat this condition. Some of the studies say that if they appear in children, they disappear in 1.5 to 2 years. There's also an Hpv vaccine that contains many strains of the Hpv vaccine. It's called a quadrivalent vaccine, I can reckon. These vaccines are taken in boys and girls and available in UK and other countries. They should be taken between 12 and 13 years old, as I reckon, but some of the studies say it's up to 26 years old. Now studies say you can take it both as males and females, not specifically for females. They also this vaccine also prevents from cervical cancer in the womb in the females. So always take the vaccine even after the age limit, because who knows, the studies in the future might say, yeah, well, they are effective even after 26 years old. Okay, so let's go see the next case. So this is a CT scan of the abdomen or tummy of a child from Africa. You can notice that his tummy is extended by a very, very large liver and sometimes a large spleen with it. So this case is caused by malaria parasite known as Plasmodium, causing the famous disease malaria. It can be transmitted by mosquitoes called Anopheles mosquito. Guys, I don't know really the translation for Anopheles, but I think it's a Greek name. It must have like an origin for the name. I honestly don't know, but it's called a Anopheles mosquito. And again, it's very dangerous and a reason why the streets and the public areas should be kept clean by the government and by the people also. These mosquitoes must be eradicated from the community to prevent the spread of this parasite, the malaria. It's a serious pandemic at some of the years, especially Africa, India at other times. We have finished the 10 cases for today. So thank you for watching. Like, subscribe and comment if you like this type of videos. If you feel that you have learned something today, help us share these videos, and thank you for watching. See you in the next video.